Okay, in this video I'm going to talk about the hip bones. We have two hip bones, or os coxae, together with the sacrum. They're going to form our pelvis, or pelvic girdle. Or together they're called the pelvic girdle, and then when combined with the sacrum, they're called the pelvis. Okay, so that includes the three parts. Now, right away, if I kind of pick it up, it's kind of an odd-shaped bone, and it's kind of tricky to tell what we were looking at. Okay, one of the easiest things to identify with the hip bones is this big socket here. That big socket is called the acetabulum, and that's actually going to fit the rather big head of the femur to form our hip. Okay, now the acetabulum is kind of split between the three regions of our hip. The upper flaring portion of our hip bone is pretty easy to identify. That's the ilium. Okay, the ischium, it's going to have this big kind of rounded, kind of rough edge, which is called the ischial tuberosity, which is actually what we sit on when we are resting. And then the pubis, which is going to be kind of towards our pubic region where our genitalia are. Okay, you'll notice a big hole in between those, the pubis and the ischium, and we call that big hole the obturator foramen. It's actually the biggest foramen in the human body. It's very, very important. It actually allows several nerves to run through it, which includes actually the obturator nerve. Okay. Now, if I look at the hip kind of from this angle here, with the acetabulum facing me, that lets me know that I'm looking at basically the lateral view of the hip, because the femur is going to insert and come out, okay, which we would think would make sense. The hip doesn't come towards the middle of our body; it goes away, or our femur does. That is, okay. So this would be the medial view, and this would be the lateral view. Now, to try to figure out if I'm looking anterior and posterior, the easiest thing to use is this pretty big gap right here. That's called this sciatic notch, or greater sciatic notch, and actually sciatic nerve runs right through it. And then you'll see two little bumps above that. Okay, those are iliac spines. We have a posterior superior and a posterior inferior iliac spine, and we also have two bumps on the anterior side, opposite of that greater sciatic notch. Anterior superior and an anterior inferior iliac spine. So there's four iliac spines: anterior superior, anterior inferior, and then on the back you got the posterior superior and posterior inferior. Okay. So using that sciatic notch, that kind of helps you identify what's posterior over there, what's anterior over there. And then the final kind of thing to identify is this kind of upper ridge of our iliac region. We call that the iliac crest. The iliac crest actually can be palpated. If you kind of know, it's at kind of our waistline. So that's everything on the lateral view. On the medial view, what you can see really nicely in our model here is this kind of rough surface here. That's called the auricular surface, and we saw an auricular surface in our sacral bones, or sacrum, I should say. There's only one of those, but you'll find this in those bones, and this is that point of contact where we form the sacroiliac joint. So that concludes the hip.